and welcome. Read the following message and then press the button below to continue.
Introduction to phlebotomy. Phlebotomy, at its core, is about connecting with people during a potentially vulnerable moment in their medical journey. It is more than just drawing blood. It is a vital. As technology continues to advance and healthcare becomes more complex, understanding the fundamental ideas of phlebotomy is crucial. This course will prepare you for a successful career by exploring the profession's history, evolution, and its impact on civilization as a whole. A single mistake, such as mislabeling a sample, can have severe consequences for the patient, potentially leading to incorrect test results, misdiagnosis, or inappropriate treatment. This underscores the critical need for meticulous attention. Key professional duties. First and foremost, positive patient identification is essential before any blood is drawn. This typically involves asking the patient to state their full name and date of birth, then comparing this information to the test request form. This meticulous step acts as a critical line of defense against potentially serious errors, as incorrect test results from misidentification could lead to misdiagnosis and inappropriate treatment. Phlebotomists must also verify if the patient has followed pre-test instructions, such as fast. After blood collection, proper specimen handling and transportation are crucial. Each tube must be carefully labelled at the patient's bedside with date, time, and phlebotomist's initials to prevent mix-ups. Specimens may require specific handling, such as refrigeration or light protection. Core professional competencies. To excel, phlebotomists need a blend of technical proficiency and interpersonal skills. This includes mastering venipuncture techniques, effectively communicating with patients, and technical skills for accurate blood collection are continuously updated to meet the latest standards. Phlebotomists must be proficient in various methods like venipuncture and capillary puncture, knowing when to apply each, and safely using equipment such as needles. Effective communication and patient interaction are equally important. Phlebotomists often encounter anxious, scared, or painful patients, requiring them to calm, explain procedures clearly, and answer questions empathetically. Venipuncture techniques require adjustments based on patient demographics. Understanding these differences is crucial for successful and safe blood draws. For adults, common venipuncture sites are the antecubital fossa, using median cubital, cephalic, or basilic veins. A 21-23 gauge needle is typically used, inserted at a 15 to 30 degree angle. Drawing blood from children requires extra care. Smaller needles, 23 to 25 gauge, or butterfly needles and syringes are often necessary to control blood flow. Distraction techniques and a calm demeanor are crucial to minimize anxiety. Parental assistance may be needed to stabilize the child's arm. For example, a child might be given a toy or shown a cartoon to divert their attention. Elderly patients often have fragile veins prone to collapse or bruising, requiring a very gentle touch and smaller needles or butterfly needles. A shallow angle and gentle technique are vital. Phlebotomists must be aware of medical conditions or medications affecting veins. For instance, some medications thin the blood, increasing bruising risk. Specimen collection and preservation. Proper blood collection and preservation are essential for accurate test results, as different tests require specific collection tubes with unique additives to prevent clotting or preserve blood components. The order of draw is critical to prevent cross-contamination of additives between tubes. According to CLSI guidelines, the typical order is blood culture tubes, coagulation tubes, light blue, serum tubes, red or gold, heparin tubes, green. After filling, each tube must be gently inverted several times to mix blood with additives, then accurately labelled at the patient's bedside with their name, date of birth, collection date, time, and the phlebotomist's initials. Equipment handling and maintenance. Phlebotomists utilize a variety of equipment for blood collection, including needles, syringes, tourniquets, and collection tubes. They must know needle safety is paramount to prevent needle stick injuries. This involves using safety needles with built-in shielding, immediate disposal of used needles in sharps containers, and never recapping needles. For example, safety-engineered needles have before use. All equipment must be inspected for damage or defects, and expired collection tubes or damaged needles must never be used. Regular maintenance, such as cleaning and calibrating blood collection tubes and uses. Understanding the specific uses of different blood collection tubes and their additives is a key part of a phlebotomist's work, as each red top tubes. These tubes have no additives and are used for tests requiring serum, where blood is allowed to clot, and serum is then separated by centrifugation. Common tests include blood typing and certain chemistry tests. Lavender top tubes, containing EDTA, an anticoagulant that binds calcium to prevent clotting. These are used for complete light blue top tubes. These tubes contain sodium citrate, another anticoagulant, and are used for coagulation tests like prothrombin time (PT) and activated partial thromboplastin time (APTT). The precise ratio of blood to anticoagulant is critical for accurate results. Green top tubes, containing heparin, an anticoagulant that inhibits thrombin formation. These are used for certain chemistry tests, such as ammonia and electrolytes. Grey top tubes. These tubes contain sodium fluoride and potassium oxalate, which inhibit needle selection and insertion. Choosing the right needle and using the proper insertion technique are crucial for a successful and comfortable blood draw, minimizing patient. Needle gauge refers to its diameter, with smaller gauge numbers indicating larger needles. For most adult venipunctures, a 21 or 22 gauge needle is appropriate, while smaller 23 to 25 gauge needles or butterfly needles may be used for children or patients with fragile veins. For example, a 25 gauge needle is significantly thinner than a 21 gauge, causing less pain, but having a Needle length should be appropriate for vein depth. A 1-inch needle is typical for routine venipuncture, but a 1.5-inch needle may be needed for deeper veins or obese patients. The insertion angle should be shallow, typically between 15 and 30 degrees, to avoid going through or sliding along the vein. A steeper angle. Patient preparation and comfort. Making patients comfortable and prepared for a blood draw is an essential part of the phlebotomist's job, as it significantly reduces anxiety and improves cooperation. This includes effective communication involves explaining the procedure clearly and answering any questions patiently, which helps ease anxiety and build trust. Positioning the patient comfortably in a chair or lying down with the arms supported and extended is also crucial for a smooth draw. For instance, studies show that patient vein selection requires careful palpation to identify suitable veins, avoiding scarred, bruised, or swollen areas. The tourniquet should be applied 3 to 4 inches above the venipuncture site, tight enough to impede venous blood flow, but not arterial flow. Cleaning the site with an alcohol swab in a circular motion, allowing it to dry completely, is vital for infection control. Infection control and safety protocols. Phlebotomists must adhere to strict infection control and safety protocols to protect both themselves. Hand hygiene is fundamental. Wash hands thoroughly with soap and water, or use an alcohol-based hand sanitizer before and after each patient encounter. Personal protective equipment, PPE, is also essential, including gloves, lab coats or gowns for venipuncture, and face shields or masks if splashing blood. Sharps disposal requires immediate placement of used needles and other sharp objects into puncture-resistant sharps containers, never recapping needles. Work surfaces must be regularly cleaned and disinfected with appropriate solutions. A clear plan for managing blood or body fluid spills, using absorbent materials and thorough disinfection is also crucial. Strict adherence to CDC. Challenging patient scenarios. Phlebotomists frequently encounter challenging patient scenarios, including anxious or uncooperative patients and those with difficult veins. For anxious patients, a calm and reassuring demeanor is vital. Explain the procedure clearly, answer questions patiently, and use distraction techniques like conversation or a stress ball to help them relax. For uncooperative patients, try to understand their concerns and gain cooperation. If refusal persists, document it and notify the healthcare provider. When dealing with difficult veins, strategies include applying a warm compress to dilate veins, using a blood pressure cuff as a tourniquet, inflated just below diastolic pressure, or employing a vein finder to locate suitable veins. If necessary, asking another phlebotomist for assistance is a professional and safe practice. Precision and scientific knowledge. Phlebotomy extends beyond merely inserting a needle. It demands a solid understanding of anatomy, physiology, and laboratory procedures. This scientific knowledge is crucial for accurate. Phlebotomists must comprehend the circulatory system's intricate workings, including the location and function of veins, arteries, and capillaries. They also need to understand how different blood tests are performed and how to interpret their results to ensure sample integrity and relevance. For instance, knowing the difference between venous and arterial blood is critical. This comprehensive knowledge empowers phlebotomists to collect blood samples accurately, troubleshoot potential issues during collection, and contribute meaningfully to the diagnostic process. Their precision, professional ethics, and patient interaction. Phlebotomy is a profession built on trust, respect, and a deep commitment to patient well-being, requiring a strong ethical framework. Patient confidentiality is at the heart of medical ethics. Phlebotomists handle sensitive patient information, from names and dates of birth to medical history and test results. Maintaining this privacy is not only a legal requirement under HIPAA, but also a moral imperative. For example, discussing a patient's diagnosis in a public area, even protecting patient confidentiality involves secure data handling, discreet communication, and limited information sharing. Electronic health records must be password protected, paper records stored in locked cabinets, and conversations about patients should occur in private areas. Only share information with healthcare providers who need it for treatment. Informed consent procedures. Informed consent is the process of obtaining a patient's permission before performing a medical procedure. This involves providing the patient with sufficient information about the procedure, its risks, benefits. In phlebotomy, informed consent requires the phlebotomist to identify themselves, explain their role, and describe the blood draw procedure in clear, simple language, avoiding technical jargon. They must also explain the purpose of the blood draw and the tests to be performed on the sample. Crucially, phlebotomists must discuss potential risks such as pain, bruising, or infection, and the benefits like diagnosing a medical condition. Patients must have the opportunity to ask questions, and their consent must be documented in their medical record. Patients retain respecting patient autonomy. Patient autonomy is the right of individuals to make their own decisions about their medical care, including choosing treatment, refusing treatment, and seeking second opinions. Phlebotomists respect patient autonomy by providing comprehensive information, supporting patient decisions, even if they differ from medical recommendations, and avoiding any form of coercion. They also promote shared decision-making, collaborating with patients and other healthcare providers to develop treatment plans that align with individual needs and preferences. For example, if a patient expresses a preference for a specific arm, effective communication is a cornerstone of patient-centered care, requiring phlebotomists to communicate clearly, empathetically, and respectfully with diverse patient populations, considering varying levels. Communication strategies. Effective communication is a cornerstone of patient-centered care, requiring phlebotomists to communicate clearly, empathetically, and respectfully with patients from diverse backgrounds and with varying. To reduce patient anxiety, phlebotomists should create a calm environment, use a soothing tone, and empathize with patients' fears. Providing distractions like music or a stress ball, or teaching simple relaxation techniques such as deep breathing can significantly help manage anxiety. For example, explaining procedures clearly involves using simple language, breaking down steps, and using visual aids like diagrams or models. Checking for understanding by asking questions ensures patients grasp the information. When managing diverse patient populations, cultural sensitivity, health literacy, workplace safety and compliance are crucial for protecting healthcare workers and patients. Adhering to guidelines creates a safe environment in phlebotomy. Workplace safety and compliance are not merely a set of rules. They are the foundation for protecting both healthcare workers and patients. Adhering to guidelines is crucial for creating a safe and compliant environment in phlebotomy. Protecting oneself and patients begins with understanding and consistently applying safety protocols designed to minimize risks associated with handling blood and other potentially infectious materials. This includes rigorous hand hygiene, which is the single most effective way to prevent the spread of infections. Personal protective equipment, PPE, is a primary barrier against hazards. This includes wearing gloves, gowns, and face protection, masks and eye shields during venipuncture and when handling specimens. Proper use and disposal of PPE, such as changing gloves between patients and immediately disposing of sharps in puncture-resistant containers, are non-negotiable. Medical waste disposal. Proper disposal of medical waste, also known as regulated waste, is essential to protect healthcare workers, patients, and the environment from potential infection. This medical waste must be segregated from general trash at the point of origin, using designated containers for different waste types. Rigid, puncture-resistant sharps containers with a biohazard symbol are used for used needles, lancets, and other sharp items, and must never be overfilled. Red biohazard stored in a secure area, away from public access. Medical waste must be disposed of according to federal, state, and local regulations, often involving licensed medical waste disposal companies for incineration or autoclaving. OSHA guidelines. The Occupational Safety and Health Administration, OSHA, is a federal agency dedicated to ensuring safe and healthful working conditions for workers by setting and enforcing standards and providing training and assistance. The Bloodborne Pathogen Standard requires employers to protect employees from exposure to blood and other potentially infectious materials. This includes having a written exposure control plan, implementing engineering and work practice controls, providing appropriate PPE, and offering hepatitis B vaccination free of charge to all. The Hazard Communication Standard requires employers to inform employees about hazardous chemicals in the workplace. This involves a written hazard communication program, readily available safety data sheets, SDSs, for all chemicals, proper labeling of hazardous risk management and incident reporting. Risk management involves identifying, assessing, and controlling workplace risks, particularly exposure to bloodborne pathogens, needle stick injuries. Key strategies include regular risk assessments to identify hazards in the phlebotomy area, implementing hazard controls, engineering, work practice, and PPE, and providing regular training on risk management principles. Continuous monitoring and evaluation of control effectiveness through inspections and incident report reviews are also vital. Accurate and timely incident reporting and documentation are essential for identifying trends, implementing corrective actions, and preventing future incidents. This includes clear reporting procedures for needle stick injuries, blood exposures, and chemical spills, followed by thorough documentation of the incident, investigation to determine root cause, and this section covers HIPAA regulations and their importance in protecting patient information. It also addresses essential lab safety standards for a secure working environment. The Health Insurance Portability and Accountability Act, HIPAA, is a federal law protecting the privacy of patients' health information, PHI, applying to all healthcare providers, including phlebotomists. Compliance is crucial for maintaining patient trust and avoiding legal penalties. PHI includes any identifiable information related to a patient's past, present, or future physical or mental health, healthcare provision, or payment. The HIPAA privacy rule sets standards for protecting PHI, requiring healthcare providers to issue privacy notices, limit use and disclosure to treatment, payment, or operations, and grant patients rights to access and amend their PHI. For instance, a patient's lab results are considered PHI. The security rule sets standards for protecting electronic PHI through administrative, physical, and technical safeguards. This includes password-protected electronic records, locked cabinets for paper records, and encryption for electronic data. Phlebotomists must comply with HIPAA by protecting patient privacy, only accessing PHI for job duties, and reporting suspected breaches. Laboratories also adhere to safety standards to protect workers from physical, chemical, and biological hazards, including chemical, biological, fire, and electrical safety and emergency procedures. Continuous training and certification. Phlebotomy is a constantly evolving field, necessitating continuous training and certification maintenance to ensure competency and provide safe, effective patient care. Continuing education activities keep phlebotomists updated on new techniques, technologies, and regulations. Certification renewal, often requiring continuing education and passing an exam, ensures ongoing competency. Regular competency assessments demonstrate skills and knowledge, while professional development opportunities, like conferences. This commitment to lifelong learning ensures that phlebotomists remain equipped with the latest knowledge and skills, contributing to high-quality patient care and advancing their careers in this vital profession. Many certifying organizations, such as the American Healthcare Organizational Landscape. Modern healthcare is a complex web of interconnected organizations, extending beyond just doctors and nurses. These systems typically feature a hierarchical structure, with a board of directors or governing body at the top, a CEO or president for day-to-day operations, and various departments: medical, nursing, laboratory, pharmacy, radiology, administration. Laboratory role in healthcare. Clinical laboratories are essential to every healthcare facility, from small clinics to large hospital networks, providing vital data for diagnosis, treatment, and illness prevention. Hospital labs are typically divided into sections like hematology, chemistry, microbiology, and blood bank, operating 24/7 to meet demands from emergency rooms and surgical units. They employ diverse staff, including medical laboratory scientists, technicians, and phlebotomists. Smaller clinics and physicians' offices may have simpler labs for basic tests, sending specialized analyses to outside reference labs. Reference labs are independent commercial facilities offering a wide array of diagnostic tests, including genetic. CE regulatory framework. The Clinical Laboratory Improvement Amendments, CE, form the backbone of how labs in the United States ensure correct and reliable results. CLIA's historical development traces back to the early 20th century, with minimal regulation before the mid-1960s. A 1967 Atlantic Monthly article exposed serious problems in clinical testing, leading to the Clinical Laboratory Improvement Act of 1967, CL. Concerns about laboratory quality resurfaced in the 1980s, driven by the AIDS epidemic and inaccurate HIV testing, prompting Congress to pass CLIA 88. This significantly expanded federal regulation to all labs performing human specimen testing for diagnosis, prevention, or
Well done. Thank you for completing